A major part of determining your brand identity for your telemedicine practice is determining your practice type. So, we've been discussing how brand identity is composed of many characteristics and attributes that are going to help inform your future key decisions when building your practice. Today, I want to focus specifically on the practice type that you choose. So, stay tuned to see how to best select the practice type that's going to work for you and your business. Hi, I'm Dr. Annie DePasquale. I'm the owner of Collaborating Docs. We help nurse practitioners find wonderful collaborating physicians. Today, we're going to be covering how to determine what type of medical practice you want to have, and that's a big part of your brand identity. To begin with, you see at the top of this graph, there's the spectrum of types of practices. So on the way left, things are very niche, very focused, very specific. And then on the right-hand side, things are very general. Things are very open-ended. So we're gonna discuss each of these individually. Before we do, though, I like to point out niche practices are very good to market to because you're very, very particular, specific audience that you are going for. So it's easier to run ads and connect with the right people and network when you pick something very niche. On the other hand, general practices that help everybody with everything, there are some pitfalls. It's quite oversaturated, I would say, as a market right now. There's going to be a lot of competition and it's going to cost more to market to get patients in. So just want to lay that out to begin with. Doesn't mean you can't do it, but it's something to consider. So now we're going to go through each of these 4 practice types individually. So starting with the most niche is when you pick both a service line and a population. So you're specific in 2 areas. What am I talking about? So I'm talking about, for example, new moms who need or want nutritional counseling or maybe breastfeeding support. Second idea, type 2 diabetic patients who are homebound, elderly, and need care for their diabetes. Last possibility would be, as an example, mental health care for the LGBTQ community. So as you can see, there's a service they're offering, it very specific, and a type of patient population. This is very easy to market to and find the right audience. Granted, the audience will be smaller. You cannot help everyone because not everyone is a new mom. So that is something to consider. Something slightly less niche, but still somewhat niche, is at least to be specific in the service that you're offering. So I am going to offer a telemed practice that helps with diabetes specifically, or hypertension, or weight loss, nutrition, refills, hormone replacement therapy, substance abuse, lactation, psychiatry. You get the idea. So there are probably a million possible services out there. Now, you're not picking all of these. You're being specific. You're picking 1, maybe 2 or 3, but the more specific, the easier to target your audience. Getting less and less specific, you could just pick the patient population you're going to help. So, for example, frequent travelers, you could have sort of a concierge practice with wealthy clientele that are going to pay cash. You could do just men's health or just women's health or just pediatrics. But keep in mind, the services are going to be pretty broad. You're probably offering primary care, urgent care, chronic care to all these people. So there's more competition. It's harder to target those people. If you're doing women's health, you're targeting half of the population. So it can be a bit of a challenge, not to say it cannot be done though. And then basic care is really my personal least favorite, especially for telemedicine. This is when you're offering potentially wellness visits, although that can be complex via telemed, definitely sick visits, primary care, urgent care, chronic disease management. But the problem is you're competing with Teladoc, MD Live, Amwell, the list goes on. It's hard to compete with companies that can run national ads on television, radio, Facebook. It's really going to be a challenge to stand out from the crowd. So my honest opinion is to be as niche as possible. If you are going to be a telemed practice of one or maybe a few providers, like a small practice, be as unique as humanly possible. It's going to help you with your marketing efforts and getting the right people in the door. So if you are in need of a collaborating physician, please check out the link in the description below so we can help you from Collaborating Docs. I wish you all the best success, and I'll see you next time.